Hi there, I'm Jennifer Kosova, founder of Noble Functional Medicine. Today we're going to talk about medical weight loss. When we talk about losing weight, I think about stepping on a scale and looking for the change every day. And the scale couldn't be any more misleading. If you think about it, if I am going to the gym and eating healthy and I put on 5 pounds of muscle and at the same time I lose 5 pounds of fat, that scale is going to say 0. I'm going to feel like I'm not getting anywhere. So I think the first thing to recognize is we need to really stop focusing on how much we weigh in pounds, but actually what our weight is made of. How much of it is muscle? How much of it is fat? How much of it is bone? And so we're going to talk about that in these coming slides and what we can do to pull on all those levers in the most effective way to make your body composition change meaningful. So an overview of what we're going to talk about, why we gain weight. If you remember when you were 20, you could go to Taco Bell, through the drive-thru, drink alcohol all night, wake up and eat Doritos, hit the gym for a week, and you're back in a bikini again. And that doesn't work that way anymore when you're 40. Why not? Why does it even matter? Everybody's a different shape and a size. Why does it even matter if we have extra fat around our belly? Are we overfed or underfed? Believe it or not, overeating isn't the only cause of poor body composition. You have many patients, actually I have many patients that are underfed. I see this a lot in my perimenopausal women who are starting to have some hormonal weight gain around the abdomen, and they think that depriving themselves of calories, eating only salads all day, is going to do the trick, when actually they're doing themselves a huge disservice by underfeeding themselves. The hierarchy of hormones is so important. The way we manage our glucose, the way we build muscle, all depends on how our hormones are functioning. And there's a certain hierarchy to treating the hormones. If you start working on the wrong thing first, it's like a pyramid. You have to start at the base and have a good foundation. Nutritional biochemistry. Nutritional biochemistry speaks to how we feed our body, how we fuel it with the macro and micronutrients. Muscle, we're going to talk a lot about muscle today. Muscle is a very metabolic fiber in our body. It burns calories. It wants to eat the food that you are eating. You need your muscle. If you are allowing yourself to lose muscle in your journey to lose weight, then you need to rethink this. Losing your muscle only means that you will be able to eat less calories moving forward, that your body will less effectively suck up the glucose or simple sugar that you give it, and that you will become an older, deconditioned human rather than a strong, powerful person. Medication and supplements. We'll talk about medication and supplements and which ones we can use to help us improve our glucose management, muscle building, energy that we need to do all of these things and stay healthy. And how to monitor your progress. So let's go. There's a couple of reasons why we gain weight. There are a few reasons why we gain weight. Hormonal havoc can cause weight gain. If we have too much body fat, we're going to convert our testosterone into estrogen. We're also going to spike our cortisol, which is going to interfere with these anabolic hormones and favor the storage of fat. If we have abnormal thyroid hormones, especially if we have some autoimmune condition like Hashimoto's thyroiditis, we can have slow metabolism, we can have a lot of cravings, we can have dysregulated appetite control. We don't know when we're full, and so we keep eating, and it's a vicious cycle. Metabolic dysfunction is another reason we gain weight. When we overfeed our body, especially with simple sugars and glucose in processed foods, we see a lot of that. Our cells actually become resistant to the hormone insulin. Insulin, believe it or not, is the most effective peptide. I have a lot of people that come to me looking for peptides, and I think a lot of providers forget that the most important, valuable peptide our body already makes, and we have a lot of tools to control it that we aren't even pulling out of our toolbox. And so as our cells become less responsive to insulin, we start to store more and more fat, specifically around our abdomen and underneath our skin. Our brain isn't able to use the fuel of glucose as efficiently because it becomes insulin resistant. So we start to develop neurodegeneration, brain fog. Our body stops burning fat. We decrease our energy production. We get fatigued. We get chronic pain and muscle aches. These are things that we have a lot of ability to control simply by the way we fuel our bodies and the way we burn our fuel. And we're going to learn a little bit more about that here later on down in this presentation. Chronic inflammation really interferes with our ability to detoxify and also to utilize our fuel. Our liver is responsible for a whole slew of chemical reactions, and we need it in order to create the energy that will burn our fat and also to dispose of the toxic byproducts that come from metabolism itself. Lifestyle choices. Lifestyle choices like poor diet, lack of exercise, chronic stress, inadequate sleep all contribute to the above three issues. If we're making poor lifestyle choices, we're having chronic inflammation, we're suffering from metabolic dysregulation, and our hormones are all out of whack, then our body just goes into panic mode. And we're doing the best we can to keep ourselves alive, but we're not going to be efficient in any of these processes. And we're not going to feel good. Why body composition even matters. If we have too much fat, we can get high blood pressure, high cholesterol, cardiovascular disease. Like I said before, our body fat actually takes our testosterone and converts it to estrogen. Not that estrogen is bad, but it's the kind of estrogen we don't need, the kind that can go on and if not appropriately detoxified, can actually contribute to a cancer burden. It can contribute to our risk of developing type 2 diabetes. It'll increase our risk of cancer. Obesity is the number 2 modifiable risk factor for developing cancer, and it's because it causes all of those downroad effects like poor metabolic function, poor cellular cleanup, and lots of inflammation. Too little muscle is a bad thing. Your muscle burns calories. The more muscle you have, the more you can eat, and you're not going to store that fat. You also need muscle for balance, strength, stability. Do you want to carry your own groceries home when you're older? You want to be able to travel and put your suitcase in an overhead bin? You're going to need a little bit of muscle, even just to pull yourself from a lying to sitting position. All too often in the emergency department, I see decompensated elderly people that need my help just to sit up in bed because they have just such poor musculature from not using their muscles enough throughout their lives. And so starting to put on muscle and build strength and build power now is great because it will serve you well as you go into your older years where you tend to be more debilitated or have more things taxing your system. Fragile bones. Bone density is so important for preventing fractures. Believe it or not, and we don't really usually think about this until we're older, but if you fall and break a hip, you've got a 50% chance of surviving the next 5 years, depending on how old you are. And that's pretty significantly terrible. So doing everything you can to decrease fragile bones, increase your bone density, weight-bearing exercises, eating enough calcium, and making sure that your estrogen levels are good enough to support healthy bones, whether you're male or female, is key. So are you underfed or overfed? Your metabolism is just a sum of all the chemical reactions that occur from what you take in to fuel it and how your body burns that fuel. And so if you're overfed, if you're consuming too many calories, especially those sugary ones, those processed foods, you're going to store glucose. Your body can only use so much at a time. Just like your car's tank, it's going to overflow. And when it overflows in your body, it stops up your liver. It gets stored. If you've ever heard the term fatty liver, that's where that comes from. If you're eating too much saturated fat, it's going to raise your cholesterol. You're going to lay down plaques in your arteries, and that can cause heart attacks, strokes, poor blood flow to your organs, and organ failure. If you're underfed, you're going to release too much cortisol. You're going to increase the stress hormone, and this is what makes your body store fat instead of burn fat. I see this a lot in my perimenopausal patients, in my women that insist on intermittent fasting for a prolonged period of time. Once you've gone past about 14 hours, your body is going to start to go into panic mode and think that you are starving. You're going into hibernation like a bear, and it's going to try to store all these calories as fat so that you can call on them later. It's doing that to protect your brain. And if you've ever been underfed to where you are hangry, experiencing brain fog, then this is happening to you. You're releasing cortisol, that stress hormone, and it's just really interfering with success for you. And so identifying those triggers, knowing how to time feeding and when to eat what is really important to try to avoid this phenomenon. Not eating enough of the raw materials that you need, excessively low carbohydrate diets. Your body needs carbohydrates in order to effectively make hormones and use them, especially in premenopausal women that are not getting enough micronutrients. Maybe they're on a really low carb diet, restricting their body, and you're not going to be able to produce the energy that you need to burn fat. You're not going to be able to utilize your hormones if you're not giving yourself adequate carbohydrates. B vitamins are integral in many of the chemical reactions that our hormones do. And so if you're not adequately feeding yourself macro and micronutrients, then you can see your body freeze up and just refuse to burn any fat or to build any muscle. Hormones are so important, not just in building muscle. I think most people think about testosterone when they think about muscle. Testosterone is a male and a female hormone. Actually, females tend to have more testosterone than even estrogen in their premenopausal years. But of all the hormones that are important to fix first, like we talked about a little while ago, insulin. Insulin is really the base of the pyramid. Insulin is a hormone. It travels around and it unlocks the doors of all your cells to allow glucose to flood in and be utilized as energy. And this energy is used to burn fat. And so you need insulin, and you need it to be very tightly regulated and very efficiently regulated. When we start to tax our body with way too much glucose or sugar, simple sugars, our body releases a bunch of insulin, and eventually our body just becomes resistant to it, kind of like your kid nagging you at the grocery store for a Snickers bar on the way out. Cortisol is the next level up. So cortisol is the stress hormone. So you see, even before I'm talking about testosterone or estrogen or progesterone, I'm talking about cortisol. Your cortisol response is very strong. I think this is from our ancestry, right? We were hunter-gatherers. We had to, hunt for food, and then maybe there was a period of time that we would be without food. We would have to store it. If our body was under stress because we were in famine, our body needed ways of protecting itself. And as humans, we've only been around for a short period of time, and so this mechanism in us is still very strong, even though it doesn't really need to be, given all the resources we have out there. Easy access to food, most people are fortunate enough to have. But cortisol, the stress hormone, will interfere with your body's ability to burn fat and put on muscle. And so dealing with this tricky hormone, getting her under control first, is very important if you want to make any effect on your body composition, especially once you hit 40 years old. Thyroid. Thyroid is your internal thermostat. It really tells your body where to expend energy and how much energy it can expend. Your thyroid is really regulated by your brain, and so one of the blood tests that's commonly checked in primary care doctor's office is the brain portion of the thyroid thermostat. That's your TSH. But that's not actually your thyroid hormone. Your thyroid hormone that's free and circulating in your blood and doing the magic that the thyroid does is actually your T3. And that's probably one of the least evaluated blood markers, believe it or not, when it comes to thyroid health. And so really knowing what your free levels are rather than just what the brain signal is integral in managing the thyroid hormone, especially if it is creating stress on the body in regards to body composition. Sex hormones. Testosterone finally comes into the picture. Testosterone is an anabolic steroid. It helps you build muscle. It's also metabolized into a hormone called DHT, which is responsible for your libido, both in men and women, and a hormone called estradiol, which is an estrogen that are responsible for mood, which contributes to your libido. Also very much responsible for bone density and strength. So it's an important hormone in both men and women. Growth hormone is, it's growth hormone. It does exactly what it says. Growth hormone release starts in the brain, and you have growth hormone receptors on almost all of your cells in your body. This is what causes cells to grow. It's much higher in young people before their growth plates seal for obvious reasons. Baby grows a whole lot more in a year than it grows. And so growth hormone does diminish as we get older. We need less and less of it, but we still do need some. And so this is the top of the pyramid. This is where we start getting into fine-tuning your ability to put on muscle once we have regulated all of the factors and hormones that lie below it on the pyramid. Nutritional strategy really talks about how we strategically give our body just enough fuel in order to perform its chemical reactions, to build muscle and to burn fat, but not so much fuel to where it gets stored or gluts up the system. And so protein is always the centerpiece of any meal that you're planning. And if you think about meal planning as starting with an empty plate, your job is to fill that plate, and you're trying to do this strategically. And so as far as strategy goes, the first thing to do is solve the protein piece of the puzzle. You're going to want to make sure that you're getting about 40 grams of protein in at each meal, which is a lot. Most people are aiming for about 100 grams of protein a day, about 1 gram for every pound of your ideal body weight. Not your current body weight, but your ideal body weight. Protein is going to help protect your muscles. If you go longer than 18 hours without any protein, your body goes shopping on your muscles for those amino acids that it needs. And it's going to pluck little bits at a time off your muscle till you gradually become under muscled and weaker. You also will slow your metabolism because you won't need as many calories to burn. And if you still eat the same number of calories, then you're going to be in an overage and you're going to start to store. So you really want to make sure that you're prioritizing your protein. By doing that, you're going to automatically crowd out some of the bad guys that shouldn't be on your plate, right? Because protein is very filling. You know, protein really will fill you up to the point where you're not going to snack as much. There's actually something called the protein leverage hypothesis. Once you understand, can really fuel your diet and help you make some real positive impact on it. It's that your body will continue to eat until it's satisfied for the amount of protein that it needs. And so since most people don't sit down to a meal and ingest 40 grams of protein for every meal, especially their first meal of the day, unless they're doing it intentionally, most people fall short of this number. And so because of that, they leave the meal still hungry, and that's when noshing and snacking comes in. So if you're prioritizing your protein and getting about 40 grams on your plate at each meal, and definitely accomplishing at least that benchmark on your first meal of the day, you're going to start to notice that you're fuller for longer and snacking less, which will help you control your intake, control the fuel better than you might have been before. The second step in strategically attacking your plate is to decide what carbohydrate you're going to put on the plate. And so a potato chip is a carbohydrate, a Twinkie is a carbohydrate, a marshmallow is a carbohydrate, but so is a piece of broccoli or a heavy grain like spelt or quinoa or psyllium husk or chia seeds. So when you're looking at a carbohydrate and you're strategically filling that part of your plate, you want to really think about, is this carb a simple carb or a carb that's likely to break down into more sugar? Or is this a complex carb that's fibrous, hard to chew? That fiber-rich food is going to go into your GI tract and actually coat it and feed your microbiome. And so you're automatically going to be basically donating some of those calories in carbohydrates to your own microbiome. And it's a win-win. It's less carbs going into you, less calorie count for the day, so you're going to be in more of a calorie deficit if you're trying to lose some weight, burn some fat, and it's going to feed your microbiome. When you do that, those little guys that are living inside of your GI tract are actually helping create these postbiotics, meaning it's after the bacteria has been fed, creates postbiotics that are actually helpful in increasing your cellular metabolism, your energy, and your burning of fat. Also, they create feel-good chemicals in your brain like serotonin. And so avoiding carbohydrates altogether is bad news because you're not feeding your microbiome. You're not going to get the fiber that you need to keep your microbiome healthy, and you're going to have more brain fog and probably more depression and anxiety because of its effect on your neurotransmitters, the happy ones, serotonin and dopamine specifically. The third piece of the puzzle to solve when it comes to nutritional strategy and planning your plate are your fats. Your body fats that you're taking in are so important that the choice is right. Again, just like we talked about with a marshmallow being a carb, but so is a broccoli. Well, as far as fats go, a stick of butter is a fat, but so is an avocado. And one is so much more nutritionally appropriate. Which one do you think it is? It's the avocado. The avocado is high in monounsaturated fats. These are good fats. These are fats that go on to help create your cell membranes. And your cell membranes are really what are responsible for cellular conduction happening without a lot of misfiring. People that have poorly made cell walls and cell membranes have a lot of chronic pain, chronic fatigue, poor neurotransmission. These people feel like they're getting mentally slower, and a lot of times just supplementing with good fats and trying to remove some of the saturated fats from the diet can really be curative when it comes to brain fog and things like that. Another thing to remember is that not all omegas are created equal. Omegas are a good source of fat, but you have EPA and DHA. EPA is the type that's more beneficial to the heart, and the DHA is more beneficial to the brain. Typically, the ratio of EPA to DHA gets higher as you get older, and that's because your brain cells, which require the DHA, are mostly formed after you finish childhood, and so at that point, the EPA becomes a little more important to protect the heart. Muscle is king. Muscle is the tissue in your body that you have to protect at all costs. Your muscle is burning fat for you. It's burning calories. You need it as you age. You need it for stability. You need to be strong as you get older to simply perform activities of daily living. You know, the strength that it takes to walk up a flight of stairs now at your age, it's going to be a lot harder 20 years from now, 10 years even from now, it will be harder. So the stronger you can make your body now, the more effective and more freedom you'll have as an older adult. You want to get at least 40 grams per meal. You want to aim for about 1 gram per pound of ideal body weight. It's going to fill you up. Protein is satiating. You're going to eat more protein and you're going to do resistance training. You're going to put on some muscle, and that muscle is going to make you stronger, both in your metabolism and in your movements. What are the treatments that we can use to help with metabolism, to help with body composition, help with doing all of these things to keep our body burning fat and making muscle efficiently? There are weight control meds. I think everybody knows a little bit about them now. Unfortunately, I think a lot of what we know about these drugs are coming from social media and people that maybe are not qualified to talk about the pros and cons of them. But, you know, the inside scoop is this. These drugs are incredibly effective tools. I use them a lot. I am both excited about them and I am also quite afraid of them. With my patients, when I use these drugs, the first piece of the puzzle that has to be solved before we call these drugs in to use them is the nutritional piece, right? If I know that my patient isn't going to get in enough protein, if the rules that we talked about when we discussed muscle aren't being met, the 1 gram of protein per pound of body weight, the 40 grams in the first meal of the day to start muscle synthesis and start protecting those muscles, if we haven't gotten to that point in our plan yet, then taking these drugs can be quite dangerous for those people. if I dim their appetite, which is what these drugs do very effectively, if I dim their appetite, they are not going to want to eat a chicken breast. They're going to want to eat a saltine cracker if they want to eat at all. And that is not going to help anybody, because if they're not getting in the protein, their body is picking away at their muscles, chewing away at it, and they are going to, every single month that goes by, become less and less and less muscled. And as they lose that muscle, the number of calories they're allowed to eat every day goes down further and further and further and further. And before you know it, when these people continue to eat the same way that they always have, now they are in a calorie excess and they are putting on more and more weight. They're basically exchanging their muscle for fat, but they're getting smaller because muscle weighs a lot. And so they're happy because they get on the scale and the number's going down. They put on their pants and the pants fit better because they've lost all of that muscle underneath, in addition to some percentage of fat. And so the weight loss drugs are very effective if we have a good nutritional strategy in place and the patient is doing some resistance training, eating appropriate amounts of protein so the muscle is protected, and then I can melt away the fat using these drugs, supplement, exercise, and adjusting everything that's going on with their poor metabolism, hormone optimization, and their micronutrient levels. This is a pyramid of things that need to be addressed first before we can really get the machine fine-tuned enough to where it's effectively burning fat without burning muscle as a side effect. Mentioned hormones. Hormonal issues can definitely cause weight gain. As a woman's estrogen drops in menopause, or as a man's estrogen goes up because of body fat converting the testosterone to estrogen, these two things can really pull on one's ability to put on muscle and burn fat. And so stabilizing these things, providing the bone protecting estrogen to menopausal women when needed, and providing testosterone replacement to both men and women when needed can really help improve body composition by improving lean muscle mass and improving fat burning potential. And glucose management as well. When we go through menopause, that drop in estrogen really wreaks havoc on our ability to control our glucose. Supplements can be incredibly effective, but it's important to know that a lot of the formulas out there, especially the ones that are very heavily marketed in pretty packages all over your Instagram feed, typically have a pixie dust sprinkling of what's good in there. For instance, I put most of my patients on 2 of B12 on a daily basis, some as high as 2,000 if they have genetic disparities that make them more resistant and require higher doses. A lot of the blend supplements that I see that my patients will send me that they find on Instagram maybe have 2 or 3 micrograms a day, and that's just peeing on a fire is the way I say it, because it's not going to help increase the utilization of the hormones. It's not going to overcome any methylation defects that are causing poor detoxification. It's just not enough. Making sure that you're on a supplement regimen that makes sense, that has appropriate dosages of the active ingredient that's helpful to you, is really going to help you streamline your medicine cabinet so that you're not taking 4 million things that aren't helping you at all. Nutraceuticals can be incredibly effective. You know, it's somewhat hard to get in 100 milligrams of, it's hard to get in 100 grams of protein every day for busy people that don't have time to cook all day without utilizing some nutraceuticals. And by that I mean protein. Really important to know the difference between whey proteins and vegan proteins, how to best utilize them, what amounts you need, what times of day they're best to take, how to combine them with your exercise strategy so that you can increase your muscle building, so that you're feeding yourself an appropriate amount of protein. And so these powders and supplements can be incredibly valuable. Things like creatine, things like fiber, all of these things can help regulate your appetite, increase your gut effectiveness, digesting and detoxification, and reducing inflammation. We monitor progress. I love monitoring progress. There's nothing better than checking in with somebody and just getting so excited and celebrating success. And this might be one of my very favorite DEXA scans on an actual patient of mine. You can see starting at the bottom, she had DEXA scans as she was going through her weight loss journey or her body composition improvement journey. She started out with 2.66 pounds of fat around her abdomen. You can see that here. She was able to shrink it down all the way under 1 pound of fat, 0.92 pounds of fat over the course. This was actually a 7-month from beginning to end follow-up on this patient. I was tremendously proud of this patient, reviewing these follow-up results with her. Logging your food. You know, I don't think that there's anybody that wants to log their food forever. It's a real pain in the butt. You decide to really commit a week to it to get a good insight on what you're actually taking in. You're going to find that just eyeballing it and winging that calculation is very, very off. You're going to be off on your numbers. The one that I find that people are most off on is the amount of protein that they're eating. They're very much overestimating that, and they're underestimating how much fiber they're taking in. You're going to want to be about 30 to 40 grams of fiber a day, and I think the average person is getting about 15 grams a day. Fiber is a tremendously beneficial ingredient to add to your nutritional strategy. I think it's the one that's skimped on the most because I think people feel that it's mostly for pooping. And although your GI tract is mostly for pooping, it's also responsible for so many other things that fiber helps with. The balance of your microbiome, feeding your microbiome, the protection of the membrane that keeps every single thing that you eat out of the free circulation in your body. It chooses what can stay and what can go. It's responsible for your hydration, which is, you know, if you're not worried about your weight, think of your skin. Your skin requires great hydration. And so maintaining a great gut that's functioning efficiently is imperative that fiber is in the equation. Blood biomarkers can give us a really good insight on how you're improving. I look at people's fasting glucose and insulin numbers, and that tells me how they are fueling their body versus how much fuel they're using. It will give me clues if they're overflowing the tank. And also look at hormone imbalances, see how likely they are to be able to adequately put on muscle by looking at testosterone levels. Beyond testosterone, we can look for hormonal imbalances that might end up affecting the bones in the long run, like estrogen levels. Estrogen levels really tell us how much bone protection we have from that hormone. Unfortunately, there aren't that many prescription drugs that are effective at helping prevent fractures. Make the shell of the bone hard, but really making the meat of the bone, the inside of the bone, where the pudgy bone is hard, that's really the job of estrogen. And so blood markers can give us a lot of insight as to how healthy your body composition is. Reassessing your nutritional needs. The more muscle you put on, the more fat you lose. We're going to have to readjust your nutritional plan, right? I want to make sure we're feeding that muscle, that we're reassessing your caloric needs based on how active you are. Hydration is another thing, assessing how much water you need in your body based on how much physical activity and how much you're sweating is really important to maintain good blood flow and electrolyte levels and good muscle conduction. We adjust medications and supplements when needed. If a patient plateaus, that's a sign that we need to make a small adjustment somewhere. And if we look at all of these factors above, we're going to get some clues as to where that adjustment would be most effective and what's going to improve the picture the best. Why functional medicine? Functional medicine because we think of all these things, right? I don't think that anybody listening to this can think of a time where they've sat in their doctor's office and received this kind of information. Unfortunately, you know, our medical system right now is too busy treating the 60% of adults that have chronic disease already by prescribing and monitoring their medications and screening them for worsening disease. We don't do preventative medicine in the doctor's office anymore. It just doesn't happen. You know, eat less and exercise more isn't always the answer. And if it is the answer, it also requires explanation. And so, a real personalized assessment to look at somebody's current situation and figure out what are they doing that they think might be the right thing for them because it's worked for them in the past, or they saw it on Instagram, or it works for their uncle or their brother's cousin. Knowing your personal history and really looking at the individual specifically rather than trying just to apply a one-size-fits-all approach through a keto diet or a DASH diet or a HIIT program or berberine. Putting all of this together and making the treatment individualized is the only way to have laser-focused success. That's really, centered around the person. And it also gives that person the tools to be able to know what works for them in the future and to become an advocate for their own healthy body composition. Nutritional guidance. I went to school for a long time to learn how the body works, to learn what chemical reactions make what happen, and really knowing how to appropriately prescribe the fuel and the changes in strategy to affect the positive changes we're trying to make in our body is key. And, people aren't just born knowing that. It takes a lot of studying. It takes more than scrolling through Instagram to learn those things. And in each one of those, special diets that the advocates of those diets claim to be the best diet for everybody, there's pieces of truths and untruth, ways that you can apply it that are helpful and ways that it will be deleterious to you. But knowing which pieces are good and which ones are not going to work for you is something that takes somebody who's done some studying in this field in order to help apply it. And in functional medicine, we have a great deal of training in that. Lifestyle modifications, knowing what you're at risk for through signs of genetic malfunctions, signs of biomarker abnormalities, blood ranges being at the right or the wrong end of the range can help determine what somebody can do simply within their grasp that's outside of the medical system, that doesn't require a medication, to actually affect change for themselves. And again, to stock their tool belt with tools that they can use in the future to keep themselves healthy and know what works and how to progress that and get more and more out of it. Can be very empowering for people to learn through functional medicine. Hormone balance. There aren't that many providers out there that are trained adequately in hormone regulation. Endocrinologists are hormone specialists. They typically tend to focus mostly around thyroid disorders and some menopause disorders, but they don't really do a great job in giving us access to people who really can tell us how to optimize our hormones. One perfect example is the horrible disservice that's been done to so many menopausal women over the last 2 decades. And this is simply because of lack of education or miseducation. Only about 30% of OBGYN residency programs in the United States of America have any hormone training for menopausal women. That's such a small percentage, and the ones that do have training, typically it's only a few hours of lecture. And if you ask the average person, they're going to tell you that that's the person that they would go to when they hit menopause to talk about their hormones. And so I think educating patients to know who the appropriate trustworthy resources when it comes to knowing how to balance hormones safely, what our resources are out there to not only treat to not only treat hormone imbalances, but also to screen for them appropriately and to monitor the therapy, right? When we give somebody hormones, that's not the end of the day. Then they are going to metabolize them. We need to make sure they're metabolizing them safely. Functional medicine does a great job at looking at these things, knowing what our resources are to test both in the blood, the urine, and even in the saliva for some hormones like cortisol. Really having a great functional understanding of how hormones work, how they're prescribed, and how they are tested is integral to making sure that yours are balanced. And then monitoring and support. to really have access to your provider, to be able to participate in conversations about yourself, about your healthcare, to be an advocate and to be a team member for your health is just so important. And one of the things that I love about our program here at Noble Functional Medicine is that not only do we take the whole person into account and we look for ways to address anything within the lifestyle, we provide nutritional guidance, we make sure all of the biomarkers are balanced, we provide optimization when needed, and we monitor that optimization to make sure it's effective. But we also are a resource to our patients, because the more I can teach my patients about what's going on with them, why it's going on with them, what's going to help the most, and how we can make sure it's helping, then they are empowered in their own health, they are part of their own story, and they can be successful because they are part of a team that really cares about how they are doing and the success that they are achieving with their health. Thank you so much for taking the time to listen. I hope you picked up some things that will be helpful on your own body composition discovery. And if you would like to book a discovery call with me to talk about your specific situation or issues that you're having, I would love to hear about you and explain maybe how I might be able to help. Take care.